please make sure that your microphone's on mute. That would be great. We're going to go ahead and start recording our presentation. I would also like to thank our member presenters, Paul Casterlin with ARCpoint Labs and Tony Stergio with Andrews Myers. Thanks, everyone. I'll let you guys go ahead and kick this off.
Thanks, Jody. Are you going to be presenting charts, Jody, during this?
Yeah, I'll start sharing the slides.
Oh, okay. Perfect. I'll wait till those come up, Tony.
Okay.
One last thing also, we're going to hold off on questions until the end.
Okay, can you see that, Paul?
Yes, I can. So hello and welcome, everybody. My name is Paul Casterlin. I'm with ARCpoint Labs of Austin. We're typically a drug and alcohol testing company for employees, but during the times that we're in now, we've pivoted a bit, and we're trying to help our employer customers maintain as safe as possible a work environment by providing COVID testing services. So I'm going to talk a little bit today about what types of testing are available, what some of the trade-offs are between them, and try and give you enough information to make some decisions about what types of testing you may want to be able to provide for your employees. And then Tony's going to come in after me and talk about the kind of the how, when, and what around testing, how to best structure your environment based on recommendations from OSHA and CDC and others. So if you want to go to the next slide, Tony. This will show when it comes up the kinds of testing that are available.
All right, let's see.
Wait a sec.
Not advancing. All right.
I'll just go ahead and talk. Did you get it?
Yeah, I got it. Yep.
All right. Now I got to get back to that screen. All right. Yeah, there we go. So essentially, there's two kinds of tests available. One test for the virus itself, and then the other tests that we've heard a lot about are antibody tests to see if your body has developed the antibodies against the virus. Within the viral testing realm, there's two specific types of tests that have been authorized by the FDA under emergency use authorizations. The one you probably are most familiar with, the one that's shown on TV all the time, is called a PCR test. It stands for polymerase chain reaction. That test diagnoses to see if you're currently infected with the disease by looking for RNA evidence, the actual footprint of that disease. It's often referred to as a molecular test or an NAAT test. It's performed in a laboratory, and it's kind of the gold standard for virus detection because of its accuracy. It's very high, 90% in both sensitivity and specificity. The antigen test has been out for about 8 weeks now, first offered by a company called Quidel, and now there's another company called Becton & Dickinson that has the capability to do the antigen test. Antigens are proteins that are created as the body fights off the virus, and if those proteins are detected in your mucous fluids, nasal fluids, then that means that you are currently infected with the virus. It's slightly less accurate, slightly less sensitive than PCR testing, which means there's a possibility that someone that's truly infected may get a negative result in the test. On the other side, it is 100% specific, which means if you get a positive result in this test, that means you are infected with the virus. So those are the two that check for active infections, PCR and antigen. Antibody tests are used after somebody's been infected to measure the level of protection their body has created to fight off potential future infections, and that comes in the form of immunoglobulin G and immunoglobulin M. I'm not going to go into a whole lot of detail about that because it's not a very effective test for the workplace. If somebody has antibodies, it does not mean that they are immune. There just have not been enough studies yet to understand how that relationship works and how long any potential immunity may be. So if we can go to the next slide, Tony. On this one, I'm going to talk a little bit about the balance and trying to figure out what's the right kind of testing for you. We're working with about 20 different employers right now, and we're doing both of these kinds of tests, antigens and PCRs. And we're not necessarily recommending this is exactly how you should do it because every environment's different. And I think Tony's going to help us with some of those factors here in a little bit. But the trade-offs you get with the antigen test, it's a little less accurate, as I mentioned. It's 87.5 sensitive in non-symptomatic individuals, which means somebody that doesn't have symptoms but does have the virus will catch it 87.5% of the time. It's a much lower cost than the PCR test, much faster results. We're turning results around typically in 1 to 2 hours, but definitely within the same day on the antigen test. And it's less invasive because it only requires a nasal swab. So you're just inside the nostril with the swab for this test. And we run that in our lab and send the results out that same day. The PCR test, what you gain from that is that you get a higher level of accuracy. No tests are 100%, but it is more accurate than the antigen test. It does have a higher price point, a higher cost because there's laboratory work involved. Results, we've been seeing them in about 72 hours, but we're very dependent on how much testing is going on in a particular environment. We use CPL for most of our testing, which is a local laboratory, and they've been really good with us, giving us the ability to ask for staff results in order to get people on airplanes if they need to go somewhere and have a test within 72 hours. They do get bogged down from time to time. A few weeks ago when things were really seeming to blow up in the Austin area, they were taking as much as 7 days, although we never saw more than 5. And the other limitation with the PCR test is it is more invasive. That's the one you see on TV that involves the nasal pharyngeal swab, which goes kind of straight back into your nose to get to the backside of your throat. Most people that we talk to about it ask if we're going to poke their brain when we do it. We try not to. It's good to get as deep as you can and move it around a little bit so you're able to gather as much of the resident virus that's within the person. So those are the main trade-offs between them. It's cost, timing, and accuracy are what you're really looking at, and then comfort of the person being tested. All right, I've got one more slide. I think there was some interest in this based on our prep for this. Currently, we are required to send results to Austin Public Health for PCR tests only. They are not collecting data on antigen viral test. They are not collecting data on antibody test at the time. I've tried very hard to talk to them and convince them of the value, especially with the antigen test, given that we get much quicker results from that test, and that when we get positives, they're 100% accurate. And if we can get the city of Austin to do that, it will greatly enhance their ability to do contact tracing, because I've even offered for them to have somebody camp out at our office, an epidemiologist, who we can say that person in that car right there is currently positive and just tested positive for the first time. The types of information on the left side of this chart that we have to provide for them on PCR testing are the person's name and address, date of birth, sex, race, and ethnicity can all be declined to be provided based on an individual's choice. We do need to continue to use the date of the test, date of the result, and the test result itself. And then beginning next week, we will also have to report, the week after next, August 1st, whether or not this is their first test, whether or not they're a healthcare employee, whether or not they have CDC-described symptoms, and what the date of those symptoms first appearance was, whether or not they're hospitalized, whether or not they're in ICU, whether or not they live in a congregate resident hall like a senior center or nursing home, and whether or not they're pregnant. So if that's a concern to you, that kind of data being made, then that might make you want to lean towards the antigen test at this point. And that's what I've had for now. I'm sure we'll get some good questions and discussions, but I'll turn it over for Tony to kind of go through some advice on how and when and what kind of programs work best in the workplace.
All right, thank you, Paul. Let me start my slides here. And basically my first slide, my first substantive slide is the CDC kind of just puts out 5 situations in which you might want to test employees. And really 4 of those are relevant here. The 5th is more kind of related more to public testing than actual testing of employees. The first one would be, you have an employee that shows symptoms. I don't know if a lot of you are doing kind of the temperature testing when we come in, or the questionnaires that asks, have you had a fever, have you had a cough, that type of thing. So if you have someone who has a fever, has some symptoms, or anyone who is in close contact with someone who has a positive test, and close contact is defined by the CDC as being within 6 feet of the person for 15 minutes or more. So it's not just a passing by thing, it's more of a close contact. So if you have someone with symptoms, you probably want to have those tested and their close contacts within the workplace. Okay, if someone has been exposed to the virus, and again, you have someone who is either close contact at the workplace or at home, a relation, you probably want to have them tested. However, and Paul can kind of verify this for me, if you have just had contact with someone, the test is not going to automatically become positive. I mean, there's going to be kind of a window period for enough virus to accumulate such that you're going to get a test. And I have read somewhere between 3 and 5 days between when you actually contract the virus and when a test can tell you that whether you're positive or negative. All right, if you have a high incidence at a project or a shift or something like that, the EEOC has said that you can test people at a regular interval. You can say, hey, everyone at this shift is going to be tested, say, once a week, or everyone at this project is going to be tested. If you have a high transmission and you're trying to get to the asymptomatic folks to get them out of the workplace. So you can't actually, there's going to be an expense to that, but you can't actually go in and say, hey, we're going to test everyone on this shift. You could get into some issues if you just test, for example, certain ethnicities or something like that. That would be an issue where the EEOC would likely step in and say that's discriminatory. But testing an entire shift or an entire project that's having a high incidence of COVID is perfectly okay. One of the major issues is testing once you have a positive employee, when they're going to return to the workplace. You can choose to have those folks tested to make sure that person is no longer contagious. The CDC recently has issued some guidance to say that you may want to return a worker to a work site, without testing. And they have put forth these guidelines to say, if a worker who's never had symptoms, 10 days, if the worker rather has had symptoms, you can have them return 10 days after the first symptoms first appear, and 24 hours when the symptoms are not present anymore without medication. That's been revised down from 3 days. and the other symptoms improve. So if they have an occasional cough, but the cough isn't as bad as it was, they can still come back to work 10 days after symptoms first appear. If an employee has never been symptomatic, but has had a positive test, the CDC says that they can return 10 days after the first positive test, or the CDC recommends that they get 2 negative test results at least 24 hours apart. Okay, when an employee tests positive or is potentially positive, has a close contact with someone at home who is positive, you're going to want to tell the other potential close contacts at the workplace. You're going to want to send a notice identifying the work unit that that person was on, when they were on the site, but you're not going to want to identify the employee by name unless you have a written consent. So it's going to have to be someone who worked for Andrews Myers. They were on site on Tuesday. They were symptomatic at the time or asymptomatic. We've since found out on Wednesday that person from Andrews Myers tested positive. So if you were in contact with someone from Andrews Myers on Tuesday or before, and were in close contact 6 feet within for 15 minutes or more, you may want to go get tested. You might want to let us know so we can determine whether you should be quarantined or not. Now, if you for more accurate notification, you can actually have individuals give you authorization to say, hey, if I test positive, you can, use my name. You can have them sign a pre-authorization consent that says, yeah, you can tell everyone that I've been in close contact with, if I become positive, have that signed, specify who can be told, and specify how you can result the consent. And what that does is it kind of says, it's not just someone on this shift or someone in this crew or someone from this subcontractor. You can actually say, this person has tested positive. If you are we're in close proximity with this person for these days, we want to talk to you and we want to see what our next steps are. But if you do not have that consent, it would be a violation of the ADA to release those individuals' name publicly. What are some of the other considerations besides consents? Well, you have, OSHA, the FFCRA, which is the Paid Leave Act that was passed, I think, in April or May, and the ADA has additional considerations. So I want to quickly go through some of these because these issues are some of the ones that I've been dealing with every day since this pandemic first struck. OSHA first issued a guidance that said, yeah, we're not really concerned about COVID infections at work. They're really not going to be recordable. They then came back and said, no, we changed our minds. If a COVID infection occurs at work, it is going to be a recordable injury, but you have to make an investigation to determine whether the infection occurred at work or whether it was from community spread. And some of the things OSHA says you have to look for are things like, did you have a group of employees all at once kind of test positive? Can you eliminate work as a possible spread, or is there another indication? Did these guys who work together also live together? Are they kind of housemates or apartment mates? But if you're having a cluster of infections in one shift, in one project, those are likely going to be recordable on your 300 log. Now, they could become reportable if within 30 days of the infection, you either have an inpatient hospitalization as a result of the infection or a fatality. So if that occurs within 30 days, which it likely will in COVID, if you have an infection, if you're going to have a hospitalization, that usually occurs in week 2 or week 3 or something like that. If you have an inpatient hospitalization for care, that's actually when you're supposed to pick up the phone and call OSHA and say, hey, I have now had an inpatient hospitalization. You have 24 hours after an inpatient hospitalization to make that call if the inpatient hospitalization occurs within 30 days of the infection. And OSHA has indicated that OSHA doesn't have a standard on this, obviously. The only standard that we've seen thus far is out of Virginia. Their state OSHA has just issued a standard. But, employers can get cited for not taking COVID-related measures under the general duty clause. It's a serious condition that you know about, and you should be taking precautions, such as having a testing protocol, such as having a quarantine protocol. If you do not have one and your employees are exposed to the hazard of widespread COVID infection, you could get cited under the general duty clause. And now, since I think it was a year ago, the Fifth Circuit has decided that multi-employer is back in Texas. You don't even have to create the hazard. So even if you're doing everything right, but you know that you're working next to a subcontractor who is not testing, is moving folks around that have been quarantined, who is not taking any precautions with respect to the virus, and you're working next to them, your employees, if they are exposed to those folks that are kind of having rampant spread of COVID-19, you could actually get cited as an exposing employer if you knew or should have known of the hazard and failed to take steps to abate it. You failed to either discover that you were working with a subcontractor who was not taking reasonable precautions, and you failed to take steps to abate that hazard. Okay, the FFCRA, which is the Families First Coronavirus Response Act. So there's actually two types of leave under this act. And if you look at the left side of this chart, it kind of shows the type of leave in which you're going to get 10 days of paid leave total for any of these three reasons listed. And it could be caring for a child that you're the only person who can take care of the child due to unavailability of school or daycare. You can get 10 days of leave for that at 2/3 regular pay, up to $200 a day. You can also get that 10 days of leave for caring for someone who is quarantined. You can also get 10 days of leave at your full regular rate, up to $511 if you're quarantined by a government order, if you're quarantined on the advice of a healthcare provider, or if you're awaiting diagnosis and you've had symptoms. Now, this act was kind of passed, before we knew about a lot of asymptomatic spread. So it says specifically that if you're waiting diagnosis and you have symptoms of COVID, that may be kind of already outdated, and the DOL is kind of interpreting that differently now. But those are all three of those situations you can get 10 days of paid leave. There's also the emergency FMLA, which is outlined on the right side of the chart, which says you can get 12 weeks of leave to care for a child who is out of school or out of daycare. Now, the first 10 days of that leave are unpaid. The next 10 weeks of leave are paid at 2/3. So someone can actually use their emergency paid sick leave to fill in the first 10 days and then get 10 weeks of paid leave under the emergency FMLA. Something to note, you only get 10 days of paid leave under the Emergency Sick Leave Act. So if you use your 10 days to care for a child or to care for an individual, you're not going to get those 10 days of paid leave if you in fact get quarantined, if you in fact get COVID, or if you have, or if you're out for a test awaiting diagnosis. Further, if you are put out because of you're waiting for a diagnosis twice, you're not going to get, 20 days of paid leave. You're only going to get 10 days of paid leave. And you may well qualify for other leave, such as your PTO or family and medical leave, which is unpaid, but you're not going to get another complement of this paid leave under the FFCRA. And that may change. Congress may come back and and modify that. But at this point, that leave is is the only paid leave out there. The good part about this leave is that the employer is reimbursed every time they have to send their employee-related taxes to the IRS. At the end of the quarter, they get a credit for any kind of paid leave that they make under this act. Now, as I said, the DOL has been telling employers that this FFCRA leave is related to any COVID-related leave, even if someone doesn't have symptoms, and that may be a result of just changed knowledge about the disease, but that Congress hasn't gone back and amended the act. So the Department of Labor are saying, like, hey, if anyone's going for testing and they're awaiting testing, they qualify for this leave. The question is when you submit your credits on your quarterly employee tax, is the IRS going to follow suit? Are they going to say, yeah, we're going to give employers credit for all of this, even though the letter of the act doesn't provide for leave for an employee who is awaiting test results when they don't have symptoms? Okay, special circumstances. A lot of folks are teleworking. A lot of folks in Houston were teleworking, and when we kind of opened up a bit more, we said, okay, everyone, it's time to come back to the office. A lot of folks have pulled back and said, okay, we're going to go back to more teleworking. But if you, in fact, say to the folks, okay, we've been teleworking for a couple of months now, we would like everyone to resume in-person work. What you can say to your workforce at that point is, if you do not believe you could resume in-person work, let us know. Let's talk about it. You cannot ask if an employee has underlying health conditions that prevent their return from work. A question like that would be a violation of the Americans with Disabilities Act, because you're actually asking an employee if they have a disability at that point. So you have to avoid that kind of question. You can certainly ask, however, if there's any reason you believe you can't come back to work at this point, and kind of start a dialogue with that individual as to what you can do next. Employees who have underlying medical conditions who do not want to return to work, you want them to return to work. The EEOC says simply because you've allowed telework in the past doesn't mean you have to continue to allow it indefinitely, but you have to engage in the interactive process under the ADA to determine if these folks with underlying medical conditions, if you can make them come back to work. Is continuation of telework a reasonable accommodation for them? Are there other means of mitigating the risk of COVID so that their risk of getting COVID and getting a bad outcome from COVID is eliminated, or at least reduced? I mean, can you put them in an office where no one's going to come in? Can you make their egress and ingress into the office such that they're not going to run into someone? Can you do something about lunchroom and bathroom facilities where they are not going to come in contact? Obviously, a lot of folks are going to have, masking requirements. They're going to have more hand sanitizer out, and they're going to have social distancing where practicable. But, on a construction site, there are going to be situations in which, you're going to have to get within 6 feet of someone, in all likelihood. So, you're going to have to go through this situation and say, is there any way we can get you back to work and reduce the risk of COVID-19 when we're doing it? Or is this a situation where you're going to have to, go out on leave and continue on leave, whether it be the paid leave under the Family First Coronavirus Response Act, or perhaps unpaid leave for a serious health condition under the Family and Medical Leave Act? And the question of whether they can work remotely is, can they do the essential functions of their job, or can you move some functions that aren't essential to others? Obviously, a lot of construction work in the field, you're not going to be able to do it remotely. Some of your office staff might be able to continue working remotely if they can get everything done and move forward. And some folks with underlying medical conditions have just taken the position, well, look, I want to come back to work. And the EEOC says you can't have a blanket policy preventing those folks from underlying conditions from coming back to work simply because you're worried about them. Again, you're going to have to engage in an interactive process and see what can be done to minimize the risk of COVID infection for those individuals, because obviously if an individual with an underlying condition gets COVID, it could be a severe risk of harm. So you have to talk to them about, well, okay, you want to come back to work. We understand that. We want to let you come back to work, but we're going to have to do some things that is going to mitigate the risk for you if in fact you come back to work. And there's a lot of folks that, can't telework, for example, want to come back to work, start earning a living, and you're just going to have to enter into that conversation. You can't say, for example, that all cancer survivors can't come back to work because of the risks of COVID. A lot of questions about furloughs and layoffs. If you're going to let somebody off, generally unemployment is going to kick in anytime you're going to have either a work hour reduction or a permanent layoff. They're going to get unemployment. Through the 26th of this month, they're also going to get that $600 check from the federal government anytime they have a week of partial or full unemployment. So they're going to get that. The TWC has indicated that they're not going to do chargebacks for employers during this period of time. So if you do lay someone off for COVID-related reasons or reduce their hours, they're going to get unemployment, but you're not going to get a chargeback. If you're going to have a mass layoff or a plant closing and you have over 100 employees, you have to worry about whether you need to give a WARN Act notice, which is a 60-day notice prior to the plant closing or mass layoff. So if you're over 100 employees and you're going to have a substantial layoff, contact your attorney and see whether you fall under WARN and whether you fall into an exception where you have to give that full 60 days notice. Because obviously, in this landscape, you're going to want to move quickly and give as little notice as possible so that you can get the layoff done and preserve yourself economically. If you are going to have a layoff, even if the layoff is for COVID-related reasons, economic reasons, how you choose folks who are going to be affected by the layoff can get you into trouble. A lot of times there's age considerations in a layoff. If you decide to lay off 20 people because of COVID-related reasons, you've got to make sure that all those people are not over 40. If they are, they could say, okay, I understand the reason for the layoff was economic, but the folks that you chose to lay off because of those economic conditions, be discriminated against the older members of the workforce. So you have to indicate what your selection criteria is and make sure that your selection criteria doesn't actually have a disparate impact on older workers or even workers of, for other protected characteristics, sex, race, that type of thing. So other things to think about if you are going to, in fact, engage in a layoff. And those, I believe, are my prepared slides, but certainly welcome any questions and whatnot. And I will stop sharing the screen so we can. All right, I think we're good.
Thank you, Paul and Tony, for your presentations. Those were great, very informative. Before we answer any questions, I'd just like for everybody to know if one of your team members wasn't present today and you'd like to share the presentation, it's going to be on the ABC Central Texas website on the COVID page. That's abccentraltexas.org. And you can click on the COVID page and we'll have the video on that page. Looks like we have one question. Can you please speak about the CISA order concerning critical infrastructure workers versus non-critical infrastructures?
And is that's the order out of Austin? I mean, virtually every municipality that's issuing kind of a stay-at-home order or a quarantine order has kind of had a carve out for what they call essential workers.
Yes.
In Austin, they kind of went back and forth as to determine whether construction workers were essential. They finally kind of landed on the fact that they were. There are other folks that, are essential. If they are essential, they can continue to work. They don't have to telework. I really haven't seen a great deal of enforcement on either of that, either in Houston or in Austin, as to say, like, hey, you guys aren't essential, you have to go back home or anything like that. But, most construction work throughout the state of Texas has been deemed essential, and you can continue to work on those projects. Certainly on any public projects, those are deemed essential, and work can continue on those projects, and most construction workers have been continuing to work notwithstanding the COVID outbreak.
Okay. Do we have any other questions in the room today? We have one more. If an employee travels out of the state, can they be tested when they return?
Yeah, that's a great question. Yes. If someone travels out of state, for example, when Louisiana was having a substantial outbreak and Texas was still doing fairly well, we had a lot of incidents in which folks coming back from Louisiana, should be tested. But again, if someone goes to a hot spot outside of the state or is on a airplane, they're not going to necessarily test positive right when they get off the airplane, even though they've contracted the virus. So you might want to quarantine for 3 to 5 days and then go get a quick test, so we can then tell whether they've actually contracted the virus during that kind of high-risk trip or going to a hot spot or something like that before they come back to work.
Okay, any more questions? Looks like that's it today, guys. Thank you, Paul and Tony, so much for your presentations. If anyone would like to reach out to Paul and Tony and you need their information, please feel free to contact me, Jody at ABC. And as mentioned, we'll have this recording on our website on the ABC Central Texas COVID page. Please reach out if you have any questions. Thank you.
Thanks, y'all.
Thank you all.
Right.